Following the Prime Minister's public address last night, I wanted to update people in my constituency about the latest situation in Chesterfield and across Derbyshire. I've had a long conversation with the Primary Care Network and the Derbyshire Clinical Commissioning Group and community health providers today, and also raised these matters in the House. The first thing to say is that following the Prime Minister's announcement last night, as of 4 o'clock today, Derbyshire had actually received nothing in writing about many of the issues that need to be in place in order to deliver on the Prime Minister's target as set out yesterday. Firstly, on the Omicron variant, there clearly is enough evidence to see this vastly increased transmissibility. A number of people with Omicron is doubling every 2 to 3 days. It's doubling every 24 hours in London. It's not yet known whether it is a mild variant or whether the overall consequences of it will be worse or similar to the Delta variant. What is known is that people with one dose of the AstraZeneca variant will have basically no protection against Omicron. People with 2 doses will have around 20% protection, but people with the booster jab will have between 60 and 75% protection against Omicron. So that is why there is such widespread desire for people to get their booster jabs. SAGE have significant concerns about the transmissibility, and the study from the London School of Hygiene and Tropical Medicine has predicted that even on their least damaging forecast, we should anticipate a surge to start within a week or two that will peak in the middle of January and right through to the middle of February if action isn't taken now to prevent that surge taking place. It is clear that, as we've seen right the way through this pandemic, that when you get in an increase in cases now, you will see an increase in hospitalisations a couple of weeks down the line and an increase in deaths a couple of weeks after that. And I've been critical of the government right the way through the pandemic for taking action too slow when they've been advised to take them. So I'm not going to criticise them now for taking actions before we've seen the big spike in deaths. Some people would say, why don't you wait until we see large numbers of people dying before you take action? But actually, that's what we've done in the past, and that's why the pandemics have got out of control before we've taken action. Now, Derbyshire had a plan to vaccinate their cohorts 1 to 9, 580,000 people, with an aim to have 85% of them vaccinated by January. That would have meant around 35,500 vaccinations in Derbyshire every week. When the offer was sent out a couple of weeks ago to all 18-year-olds to be vaccinated by the end of January, they escalated that plan for 35,500 a week in Derbyshire to 65,000 a week by the end of January. The Prime Minister's statement yesterday, bringing the full 408,000 additional people, those not in cohorts 1 to 9, brought forward from the end of January to the end of December, means that Derbyshire will need to be vaccinating 105,000 people every week. Now, that's about 180% of their current capacity, so there is a real need to increase the capacity that we have in Derbyshire if the Prime Minister's target is going to be met. There is a need for the NHS to be vaccinating 1 million people every day. Locally, that looks like 105,000 people a week in Derbyshire. In order to achieve that, there needs to be flexibilities given to the rest of the NHS to enable the NHS to prioritise vaccinations. That means the suspension of the Winter Access Fund commitments that the Health Secretary placed on the NHS a few weeks ago. It means a suspension of the Quality Outcomes Framework payments regime, which was done during the first COVID pandemic outbreak, but hasn't been announced yet. The Department of Health also believe that the current demand for a 15-minute wait with Pfizer patients should be got rid of. They accept there are risks with that, but they think the risks of not achieving the booster rollout are greater, and so they are calling for that, and that was raised in Parliament today. The Chesterfield Royal Hospital will be targeting staff, ensuring all staff have the booster vaccine, and also addressing discharges to home. But the primary care networks in Chesterfield, in Drumfield, and indeed in Ingersoll will be prioritising the booster for the rest of the community. There are 31 community pharmacies across Derbyshire that are ready to join the pharmacy rollout and are just waiting for NHS England to sign them off, and we're pushing hard to make sure NHS England sign them off. But and we have a military team that arrived in Derby today. They were promised last Wednesday. They've actually arrived today. They will be trained up in Derby and will be sent to both Derby and Chesterfield to increase the capacity for vaccinations in Chesterfield. From Wednesday, there is capacity in Chesterfield for 2,000 people to be vaccinated daily, in Stubley, in Drumfield, for between 3,000 to 4,000 to be vaccinated at Walton Hospital, and for 1,000 to be vaccinated in Ingersoll on Monday to Friday in Ingersoll in Staveley. There are no walk-in facilities available in Chesterfield, but it is possible for us in Chesterfield to achieve the numbers needed for everyone to be vaccinated in Chesterfield by the 31st of December on an appointment basis, so long as the vaccines turn up. So it is really important to understand that even though the Prime Minister said on television yesterday that he wants everyone to get vaccinated straight away, that doesn't mean that the capacity is there for everyone to be vaccinated straight away. If we all turn up to a walk-in centre today, that's 408,000 people in a walk-in centre. We can't achieve that. But everyone in Chesterfield and Derbyshire will be able to be vaccinated in those centres by the 31st of December, so long as the vaccines turn up and the vaccine appointments are available. Now, I know there will be people going onto the Swift queue system, responding to the links on the text that they've received, and then press on that link and find there isn't an appointment available. I'm urging the primary care network to get appointments available on that system as far into the future as they possibly can. But all we can say to people is if they keep going onto those links every day, there will be enough capacity there for everyone to be vaccinated by the 31st of December. And I appreciate it's really difficult when you have the Prime Minister telling you that it's your national duty to go and get vaccinated, and then you have the NHS system unable to access it. But I'm telling you that every single person, I have been assured, will be able to be vaccinated by the 31st of December, but they won't necessarily be all those appointments online right now when you look. So please keep going back. And when you get your appointment, make sure you keep it and go along to that. There are some walk-in appointments available in Sheffield and elsewhere. If we're able to get those available in Derbyshire, then I will notify people. But at this moment in time, I'm told there is capacity for everyone to be vaccinated by the 31st of December and to keep looking on the existing systems until you're able to get an appointment. So I wanted to make sure that everyone was aware of that. The final thing that I would say is that general practice is under huge pressure. It is incredibly important that people do not make general practice appointments except for urgent matters. So if you have a long-standing knee problem that you've had for 6 months, you've been meaning to go and see the doctor about, that's the sort of thing that's going to have to wait. We need to let our primary care providers focus on getting these vaccines done. I'm also aware there's a real backlog in terms of home appointments. I'm pushing our primary care network on that, and again, I will keep people in touch with the latest news on that. I've raised these issues in the House of Commons today with the Health Secretary, and you can see the response that I got here.